Welcome to Senator Bill Dodd's virtual town hall. This evening's topic, senior issues and COVID-19. I'm Rick Wynn, one of the volunteer hosts here at KSVY 91.3 FM in Sonoma. This evening's town hall is being presented on all of our platforms, including Sonoma TV, Comcast Channel 27 in the Sonoma Valley, SonomaTV.org, Sonoma TV channel on YouTube, KSVY 91.3 FM in Sonoma, and streaming on ksvy.org and on your smart home device. Just ask them to play KSVY. Senator Bill Dodd represents all or part of 6 North Bay counties, including Napa, Sonoma, Solano, Contra Costa, Sacramento, and Yolo counties. This is the latest in a series of virtual town halls Senator Dodd has held in partnership with KSVY Sonoma, our radio and TV outlets, during the COVID-19 pandemic. As I mentioned, the topic of this evening's town hall is senior issues in COVID-19. Senator Dodd has assembled 3 distinguished experts on senior issues to be our panelists this evening, whom he will introduce shortly. After Senator Dodd and our panelists give their remarks, we will present the panel with questions we have received by email, and we will open the KSVY switchboard to take your calls. The number is 707-933-9133, but please don't call that until we open the phone lines. I'll let you know. Welcome to all of you, and thank you for being here. And now, Senator Dodd, take it away.
Well, Rick, thank you very much. 8 town halls. We really appreciate you and KSVY and our panelists who are here today for convening this latest in a series of town halls. We'll be talking about seniors. This is a really important topic to me, COVID or not, but we all know that this COVID pandemic has really made this an especially important topic for seniors, and I'm very glad to be joined by this distinguished group. And thanks to the hundreds, perhaps even thousands of people tuning in tonight, the fact that you're here shows your concern. In California government right now, the focus is on containing the coronavirus pandemic, getting as many people vaccinated as possible, and preventing the resurgence of the virus as we open our economy. And I know everybody's really ready to go and we need to stay vigilant. We need to keep these masks on. We need to social distance, 6 feet apart, wash our hands, continue doing the things that we know are important, whether you're vaccinated or not. And so I really hope people will continue on this course, because not only are seniors, everybody could be vulnerable, but seniors, as we know during this whole pandemic, have been particularly vulnerable. In about 70% of our states, more than 55,000 COVID deaths occurred in the population of 65 and older. Sadly, many of these fatalities happened in care facilities where seniors were isolated from their families. That's why we're making vaccinating older Californians an absolute priority. First, we started giving vaccines to people 75 and up. That was in late January. That was in early January. And in late January, we expanded that to 65 people and older. And at the same time, we made vaccines available to essential workers, including emergency personnel and educators. Now we have administered nearly 12 million vaccines in the state. That's more than a quarter of the population. Eventually, everybody is going to be inoculated. In the meantime, seniors face certain challenges and many need additional resources and assistance. Fortunately, the state, our counties, and nonprofit communities are here to help. Here with us tonight are 3 people that are on the front lines fighting to make our senior population, to make sure that our senior population gets through this public health crisis. I'm pleased to have on my panel Mccoy Wade, Director of the California Department of Aging. In a moment, I'll ask her to talk about the ways her office is assisting in this pressing issue. Also with us tonight is Frank Nelson, Regional Manager of HICAP. And I'm going to have Frank talk to you about HICAP, but this guy is amazing. I've had him on a number of calls before in town halls, and really appreciate his time as well tonight. He'll talk about all the things his agency is doing to help seniors. And also with us tonight is the one, the only, the myth, the legend, Debbie Toth, president of CEO of Choice in Aging, a really good friend and just tireless senior advocate, somebody I respect in this field so greatly. First, let's hear from Kim McCoy Wade. Kim, welcome to the show.
Thank you so much, Senator Dodd. It is really, I can think of no better way to be marking what is really about the 1-year anniversary for most older adults and most Californians of staying home than to be with this panel of people I try to work with and serve every day, and I'm so privileged to be with. So I'm going to be brief and get out of the way and let the real experts who are doing the work on the ground tell you the real deal. But here's our perspective from Sacramento at the California Department of Aging. And Senator Dodd, I'm a new constituent of yours. I just moved to the district this past year. So happy to be here with both of those perspectives.
Well, actually, I work for you then.
Yes, exactly.
Kind of a role reversal.
It's a deal. It's a deal. So of course, the first thing that the Department of Aging was most concerned about was when the stay-at-home orders came out, and everybody was staying home. And how do we do that in a way that keeps us healthy and keeps us connected? So our job was to make sure the food programs like Meals on Wheels and senior centers kept rolling, that adult day health centers like Debbie Toth's Choice in Aging were able to reinvent and go from bringing everyone together under one roof for day services to deliveries and telephone calls, and she'll tell you more about that. But we also knew phone calls were flooding in. People had questions, information. We also knew people were lonely. So we stood up a friendship line, a statewide friendship line, so you could call and just have a chat with anybody. And we also have started giving out devices, smart speakers from Google and iPads that we purchased to try to help people connect in all kinds of ways. So we've really had to both reinvent our services and expand our services to reach people who were staying home who'd never been home before, and of course had new needs as the pandemic went from 30 days to 3 months to here we are at a year. So that's been our first, job one is keeping our services responsive and trying to meet the need. And we're so grateful that we're about to receive our 4th federal stimulus package to be able to do unprecedented levels of service. And we know the need is with us. The second big area that has been a joy to work on is vaccine rollout. To be able to bring that good news to more people. Yes, there have been bumps. There's not enough supply coming as fast as we all need it, and it's still confusing. Do you call your doctor? Do you call your local health department? Do you check My Turn? And of course, the answer is yes. You check all those things, and your pharmacy as well, as we try to get as many shots in arms. But I have to just tell you that the sharp decline in cases and particularly deaths among older adults. I get a daily report I have for a year of the number of deaths in nursing homes in particular, and just recently received one that was at 1 for the state, and after months of receiving hundreds and hundreds and hundreds. So just, it is truly moving that the vaccines are saving lives. It's no question. And then the third challenge for us, believe it or not, before the pandemic, the governor had issued a call for a transformation of how California treats aging, what it's like to age in the Golden State. Is it the golden years for all of us in the Golden State? And had really charged us to do a master plan for aging. And we're so lucky that Debbie was one of our stakeholders on that statewide stakeholder committee, all cabinet members, all in effort that just came out in January, which we hope is a blueprint and a roadmap for building back better for aging. We can't go back to where we were, and we've learned so much from this terrible time about where we can do more and better and different. So we're very excited to work with local leaders, local board of supervisors, local area agencies on aging to do master plans for aging in Yolo County, in Contra Costa County, in Napa, in Solano, and Sonoma, and really chart the way forward for what do we need to do with aging, whether it's transportation or housing or our nursing homes, dementia care. There's so many areas where we can work together and really make it truly the Golden State for our golden years. So that's how we're working in Sacramento. But again, let's hear from Frank and Debbie, who are the real experts, and they'll tell us what's what.
Thank you, Kim, and thank you, Senator Dodd, for this forum. Medicare, when you reach a certain age, or maybe before that in certain circumstances, your healthcare switches. And obviously, as we're in this situation, healthcare plays a large role HICAP is the Medicare Health Insurance Counseling and Advocacy Program. It's been around for 30 plus years and is a source where people can turn for unbiased help related to Medicare. And we've been getting a lot of calls, a lot of appointments, a lot of individual counseling appointments in which people have been questioning what Medicare covers related to vaccinations, related to the pandemic, related to care. Now, most people may understand that there are two ways a person can have their Medicare. One way is called Original Medicare, and it has 4 separate individual parts that together make a complete healthcare package. Now, of course, healthcare is challenging. And as we look at the services that are provided, for instance, under Original Medicare, Part D is the drug part. There are 32 plans this year. Every year those change. There is also a Medigap supplemental that pays for deductibles, coinsurance, and copays. The second way a person can have their Medicare is, of course, through an Advantage plan. Now, it's important to note that as your health care is playing those roles in what you need, vaccinations, of course, are a question that many people have asked. Well, what's covered? If you're in an Advantage plan, you're familiar that you may have copays for other things. But when it comes to vaccinations, Medicare has said that Medicare beneficiaries will not pay copays. Those are covered under their Advantage plan, and also there are not charges if you have your Medicare the other way as Original Medicare. Now, HICAP, as a statewide and nationwide program, is under an agency called Senior Advocacy Services. Kim was mentioning the challenges related to those in nursing homes and the challenges that we've seen. Senior Advocacy Services has 3 programs. One of them is the Long-Term Care Ombudsman program. So those of you who have had a loved one or still have a loved one in a skilled nursing facility, it's those ombudsmen that have been out front in making sure there is advocacy related to those in the nursing homes. And there's been a lot related to questions of what are people's rights. And of course, what we also run into is the aspect of fraud. So how many calls did you get today from some undescript number? The sad part is when it comes to events, these scammers capitalize on things such as COVID. In fact, there is a COVID scam. They might call and say, well, for an amount, you can pay and we will put your name on a list for a vaccination. Or maybe for early access, the scammers will try and let you know that for a fee, they can put you on a list so you can get early access to a vaccination. Or in fact, some of them have even been going door to door. Be aware that Medicare and the health department will not call you or contact you, and nobody should be asking for your social security number, your Medicare number, your bank number. In this day and age, be aware, be careful. There is an agency, and HICAP is a liaison for that agency, called Senior Medicare Patrol. If you're interested, you can look it up online at smpresource.org. But the important part is being aware of these scams. And in fact, the A in HICAP is advocacy. So as people have issues related to scams and they have questions, or more importantly, if they have questions about their health care, we're an unbiased source. We are a program through the California Department of Aging. In our particular region, the state is broken into regions. In our particular region, covers 6 counties. And know that if you call our office, you can set an appointment with a counselor. Obviously, right now in the pandemic, it's via phone. We hope to be getting back to in-person. But the number is 800-434-0222 is the number you can call. And in fact, no matter what county you're in California, if you call that number, it will route you to the nearest HICAP where you can set an appointment to get unbiased and individual help, because HICAP doesn't sell anything. And as the technical experts, we can explain a lot of the complexities and the details, whether you're turning 65 or whether you're finding yourself in issues related to Medicare. We are glad to help and be there for you as HICAP. Debbie, tell us some more.
All right. Well, thank you, Frank. Frank is one among many incredible human beings who work to ensure that Californians can understand the complexity of Medicare and what their rights are. And HICAP is one of the most beautiful services that is offered to our seniors in California. We are so proud of our Contra Costa HICAP, of Frank's HICAP. Like, our level of expertise is amazing in California. And I also want to thank Senator Dodd for always elevating the needs of our older adult populations in so many different ways, not just through town halls and information, but also through legislation. He's been a real champion for us in Sacramento. And I too am a constituent and somebody who's very proud to vote for him every opportunity I get. And with Mccoy Wade, our director of the California Department of Aging, I have to tell you, she and Marco Meach really brought a new concept to government service through this pandemic. I want to just say it's called flexibility, not something historically done in bureaucracies, but they have been truly magical. And when she talked about the ability for adult day health cares to figure out how to provide services to folks in the midst of this pandemic when we couldn't be having them come in a congregate setting, it's because of leadership like theirs that allowed us as the experts, as the providers, to say what the needs were and how we could meet them. They allowed us the flexibility to be able to do that. So it's taken a village to respond to this pandemic in a way that still meets people's needs. I want to say, I think all of us may know, may not know, we gained 3 decades of life expectancy last century to this century. And so we have this span of the population that you're hearing somebody say older adults, and somebody say seniors, and somebody say elders, and people with disabilities. And I just want to put out there that whatever word resonates for you, I want you to hear that when we're speaking, because there are so many and it's hard to know what works for anybody. I'm now eligible to be an AARP member, and I don't know what I want to be called. Am I an older adult? I don't know. I don't even feel like an adult. Anyway, that's a whole nother story. But I just want to really hone in. I'm going to talk a lot about vaccines tonight, and I'm going to talk a lot about how you deserve to live. And we have just lived through this incredibly odd year, right? If you had asked me 2 decades ago if I would ever recommend that my beloved elders, and I use the term elders, be isolated, if I would recommend that they be isolated, I would have thought you were mad. There's no way on earth. And yet, over this last year, I have told every elder that I love that they need to stay at home and they need to isolate. We know that isolation can cause reduced immune response. We know it can cause reduced feelings of joy. We know it can cause cognitive decline. We know it can cause all kinds of bad things, but this is what we've asked you to do. And we've asked you to do it because your option is either to have those things happen or to die. And now we're in this time where we have a solution, and it's called a vaccine. And in some cases it's 1 shot, and in some cases it's 2. But if you hear nothing else come out of my mouth tonight, hear this. If you get vaccinated, you will not die from COVID. That is the reason to get this vaccination. So I know that people are afraid, and I want to tell you that we have spent a lot of time at Choice in Aging, partnering with Ombudsman services, working with our county health departments to really get education out. We had our deputy public health officer providing education sessions. We had a nurse practitioner providing them. We had African-American community leaders and physicians leading these conversations. Everybody needs to be able to hear about how this process was not, no parts were skipped. Yes, it was fast-tracked because people were dying, like Senator Dodd was talking about, these huge rates, particularly in congregate living sites. And the people that I live to serve, right? So older adults, elders, frail elders, dying at rapid rates from this. And so yes, and the government fed a lot of money into this. So it wasn't just private industry doing it. There are a lot of different sources of funding. None of the steps in the vaccine testing were skipped. It is safe, it is effective, and it's the way that we're all going to get through this. And I brought up that mandated isolation piece because when you get your vaccine and your best friend gets her vaccine, you guys can get together and you can hang out and you can see each other and you can touch each other and you can take your masks off and smile at each other. Like, how much are we missing that? I can tell you my first hug post-vaccination, and I've been vaccinated because we've been doing mobile vaccine clinics for frail elders in boarding care facilities and low-income senior housing complexes. My first hug was with my sister. I had not hugged my sister for a year, and I bawled. I didn't expect that. I thought she was the one who was going to cry. No, I was like snotting, it was terrible, the whole thing. But it was just like this emotional release. And I just want to share with everybody that there's nothing like that. And it's time for us to take our turn to get our vaccines. And if you don't know how to get your vaccine, I am going to try and share my screen. Oh, I can't share my screen. If I get permission, I will share my screen and I will give you phone numbers that you can call, because one of the barriers, and I will be, quite frank, since Frank is here, I had to say Frank. I have to be frank with you, that it's not been easy for older adults to get in line, right? Not every older adult is navigating the iPad or getting online to set up appointments and answer a bunch of questions. So it has been difficult, but we have come up with ways for folks either to get a helper to help them with that, or that they can actually call their county public health department. They can call their local senior center. They can call their local adult day health center. There are a number of different places that folks can call if they need help. And so your local county public health department would be the place to go. I'm not able, for whatever reason, to share my screen with those numbers, but I'm sure that wherever this is posted afterwards, it can accompany my presentation so that you can have access to the phone numbers that are all Senator Dodd's district. It's, yeah, not working. I just tried it again. Sorry, folks. But anyway, I have those numbers. I will get them to you before the end of this is over. And I would encourage you to make the phone calls. And I also would like to say that it's not just the state that's trying to get you vaccinated. It's not just your county public health department that's trying to get you vaccinated. It's not just AARP. It's not just Justice and Aging. It's not just Disability Rights California. It's not just the California Foundation for Independent Living Centers and Senior Action Coalition. Like, everybody wants you vaccinated, and we're all out here to help you. So wherever you are in your community, I think my point would be, we have figured out locally how to do this, right? So we've been working with our county health department, doing those mobile vaccine clinics, and people call us when they need help navigating, and we know who to talk to and how to get them connected. So don't be shy. Pick up the phone and call somebody. If you don't have an iPad, you don't have a computer, you don't have a grandchild who's willing to make the call for you, pick up the phone, call your public health department, or call your local nonprofit organization that loves on you, and let us help you get vaccinated. I think that would be my, my big point today. Don't die. So I was going to try one more time and I can't share the screen. Sorry, folks. So I'm happy to answer any questions, although you can see I can talk for a really long time. So you might want to punch your questions elsewhere. I don't know.
So Rick, before I go to you to moderate the questions, I'd like to ask the first question, because they were both, all three thoughtful presentations here. So it seems like we know that seniors 75 and above were first prioritized for the COVID shot. Then some weeks later, month later, whatever, 65 and over. Do you have metrics statewide, regionally, maybe by my district or even by a certain county of how we're doing in terms of percentage of seniors with a shot in the arm? Maybe by now it should be 2 shots in the arm, frankly. So that would be a metric, that I'd really like to hear. How are we doing based on getting our seniors 75, and then the other metric would be for 65.
Yes, and we absolutely do have that on the state dashboard. And as we're talking, I am spinning it up to look at our vaccination data updated every day, both by the state and by the county level. It's currently by age, race, and gender, but we're working to make it so that you can see age, race, and gender together. But for example, right now, according to hot off the press, statewide 65 plus, 48.1% of 65 plus.
Do we have a 75? Is there a 75, age 75?
No, on this, well, I'm sure we have that data, but on the public dashboard, it's 65 plus is what's showing.
Okay. All right. Okay, Rick.
We have a number of questions with regard to vaccine, as you might expect. One question is it irresponsible to promote vaccines when they are an unapproved product that are still in trials? I think we answered that. But we have, as we prioritize our elderly, this is from Reinhard Pearson of Benicia, as we prioritize our elderly and anyone medically at risk, isn't it logical to vaccinate their family members who care for them and live with them? If our family caregivers fall ill themselves, are already overburdened healthcare system will be not ready and won't be able to take up the slack.
Yes. So I'm going to pop right in there. Absolutely. Caregivers, whether they are formal caregivers, informal caregivers, paid caregivers, non-paid caregivers, caregivers who work for IHSS, or caregivers who are a family member, they should be vaccinated. They're eligible to be vaccinated. If they are not getting through and unable to get vaccinated, then they should be calling their public health department. If they're not getting the response they need, they should be calling the state's public health department. So we have, I mean, this is a big deal, right? How we communicate, how people get their information. I think we've learned in this pandemic that everybody gets their different information in different ways. And so maybe we haven't been able to get through all the channels to get information to all the people, but you are eligible as a caregiver and you need to get your vaccine.
Well,
another question.
I'll just have to come behind and say that is actually not statewide policy. So,
well, then that's Contra Costa policy. My apologies.
There you go. So that is one of the areas where statewide there are some caregivers, as you mentioned, in-home supportive services and other caregivers and family caregivers of consumers of the developmental disability system. But not every county has gone to all family and paid caregivers. Some have, many have, because of exactly what everyone has said here. But just to answer the formal state policy question, that's not true across the whole state.
Don't let me speak on behalf of the state. Forgive me.
If the supply increases, we need to get there. And it's certainly being discussed in the context also of people at home who need a house call for a vaccine. And once those house calls start rolling, being able to vaccinate the whole house and the caregiving team as well.
I guess I think I would follow up for her and ask, why is it not statewide policy?
It's a great question. You know, it comes with the approach to limited supply and beginning with the highest risk, which was age and exposure. And so those were the places we started with: age, older adults, exposure from healthcare workers, and now food service workers and transportation workers and other essential workers. And then on Monday, it's expanded to people of all ages with high risk health conditions. So I think it's just an attempt to do it in phases. But, you know, as our president says, we hope that everyone is getting that first shot very, very soon. And I think as supply loosens, you'll see eligibility loosen. And again, some counties have already made that move.
You know, Rick, one other thing is, I thought I heard the woman who called was really thinking, should when the senior is vaccinated, should all her family be vaccinated? And that's just a supply and demand with just so she knows, it's just a supply and demand with the vaccine. We only have so much vaccine, and we can't allocate it in that manner, unfortunately.
So as President Biden says, we'll have enough vaccine to inoculate everyone by May 1st, every adult. So that should, within the next 6 weeks or so, that should solve that problem, I would imagine. State regulations currently prohibit, well, there's Stephen Hosking, and then we've got a caller, Karen Kessler, on the line. Stephen Hosking, we're back. My daughter is handicapped and stays in an intermediate care facility. My wife, daughter, and I are fully vaccinated, but state regulations currently prohibit us from bringing her home for a visit. When do you anticipate a change and that will be allowed?
Yes, I can just say that visiting policies at all of the residential facilities are being updated as we speak, as vaccination rates go up on both residents and staff. It has been one of the tragedies among many that visiting has not been allowed in so many of our facilities. Missed birthdays, missed grandchildren, and of course, missed final days with people as well. So it is absolutely a top priority that as quickly as possible, we can get visiting going again and safely and appropriately. So I can double back on the latest with those particular intermediate care facilities for those consumers, but I know that all departments are working to bring back visiting. It's so important on so many levels.
We're going to take a break from that, and we have Karen Kessler on the line. She's executive director of a statewide IHSS agency, IHSS, with a comment about another senior matter. Karen?
Hi, thank you. And I want to echo what Debbie and Kim have said about Senator Dodd's advocacy in the legislature. He's so well liked, and he's such a great messenger for the things that need to be done for seniors and people with disabilities. I'm excited to share with you today that the state has just recently announced that they will be paying IHSS providers to take their consumers or clients to get their vaccines. That's really a terrific way then for the providers to get their vaccines at the same time. The state will be paying up to 4 hours, 2 hours for the first vaccine and 2 hours for the second. And we're really excited about that policy. Also, Senator Dodd will be voting on a bill that I know he helped work on this week that will be expanding paid sick leave supplemental benefit for IHSS providers. And that will be allowing our state for the first time to be paying IHSS providers who have side effects from the vaccine. So Senator Dodd, I can't thank you enough for your leadership, and just wanted to share that really good news.
Thank you.
All right, thank you. We have on line 3, we have Joe from Minnesota, the worldwide range of KSVY, wants to ask about vaccine dose order. Joe?
Yeah, hi. Thank you for the opportunity. I know that Pfizer and Moderna vaccines require 2 shots. Now, is the second shot automatically set up, or do you have to try to get in and schedule it yourself? And that's the only question I have. Thank you.
So we've seen both. I can tell you from serving different counties there, if you're getting it through the county system, depending on whether or not you're at a mobile vaccine clinic or you're at a clinic site or you're in an office, that may dictate whether or not your second appointment is set at that time. And it differs from site to site. I'm not sure, because there are what are called multi-county entities. So like Kaiser and Sutter, these big health plans, they have their own supply. And so how they do it may be different than how a county does it. So unfortunately, I have not seen that there is a uniform way that does or does not happen. I know that at our county, you're able to see it, I believe, Kim, you can probably speak to this, when it's in the state database system, the PrepMod system, that the healthcare providers can see what type of their first vaccine it was and where they got it, so that at least if they are in for a second visit, that whoever is providing that vaccine will know what that is, so there's no risk of that. But I don't know that there's any uniform way that we're setting up or not setting up second shots. Not that I know of.
Yeah, thank you, Debbie. That's where I would start. So I'm glad to have that validated. The two things I would say is that the CDC has recently clarified that the second dose can be as much as 42 days, 6 weeks after the first dose. So don't panic if you're at the 2-week. I would go ahead and start reaching out to get that second appointment, but I don't panic. And just at least in California, we're absolutely prioritizing second dose over first dose in this time of scarcity. So that's why you might see, oh my gosh, we have a lot of doses coming into the state, but actually most of them are being used for second dose to make sure we finish the job with folks who've started. So it is important that that you reach out if you haven't heard from them, but you do have some time. And at least in California, we are prioritizing those for appointments.
Debbie, I'm told that you can try to show your screen again with those numbers. Secondly, for those of you watching or listening, you can call us at 707-933-9133, 707-933-9133 with your comments or questions for our panel. There it is. You want to explain this slide, Debbie?
I do, and I would really love to find my unmute. My husband is always looking for the mute button on me. I'm always looking for the unmute. So here we have your county public health departments. These are Senator Dodd's counties that are in his district. So if you're in Contra Costa County, you would dial 844-729-8410 and you would get the county public health department. So this was my way for if seniors are having trouble navigating electronically, that they would have a number that they could call and try and get either a warm handoff or have somebody there help them. It's really nice for older adults to be able to talk to somebody. And this is a way of not having a recording and pressing this number, ending up at this number and ending up at that number and blah, 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 blah. So I'm just trying to get you somebody to talk to, and that's one way to do it. And it's different in every community, but there's a county public health department in every county. And so that's a great starting place if you're having trouble finding a number.
Another question, when, I think we know this, when should vaccinated seniors be able to start visiting with their families again? My 2 weeks after my second vaccine was Sunday, and we had our whole family over for the first time. And I don't know if that's a technical answer, but the answer I was given. And on the other side, is there anything being done with the Department of Aging to help vaccine hesitancy amongst seniors?
Sure. Debbie, do you want to talk about the advice to folks who are getting vaccinated and seeing their grandkids? I'm also happy to.
Yes, I will just tell you the greatest thing that I have seen since the beginning of, other than the first shot that we gave where we all bawled our eyes out. But one of the greatest things that I've seen in this pandemic was a prescription pad from a physician who had just given the grandma the vaccine, and the prescription was to hug a grandchild. 2 weeks after your second shot and 2 weeks after your first, if it's Johnson & Johnson, you are at peak immunity. Hug your people who are also vaccinated.
Right.
And what about vaccine hesitancy? What are we doing to?
Sure. So I would just one a caveat to Debbie is I think we still want people wearing their masks, and we still be careful if the people in your circle are high risk. If they have health conditions, if they are older and not yet vaccinated, we still want to protect everybody. So I think, wear your mask, still try to stay outdoors, but understand that if you get the vaccine, you do get to do some things which are another reason to go, not just save lives, but to bring hugs back into your life. So I will tell you, hesitancy has been an interesting thing. When this started, we were very laser focused on this, and we're planning lots of trusted messengers, pastors, doctors of color, all kinds of folks who could talk to people who've had bad experiences with the healthcare system, who had some legitimate questions, and try to reassure them. I have to tell you, we had a meeting today with leaders from African American, Latino, Native American, Asian Pacific, LGBTQ, and hesitancy was not on the agenda. People have seen it work between their elders in nursing homes, between their kids who work in healthcare. We're now enough into this. There's still some. I'm not going to say it's a minimal problem, but the real issues are access. Is the shot available in my community at a place that I go and trust? And can I get an appointment? So the stories we're hearing about are the partnerships with the clinics and the African American Church on Sunday. So the shot clinic is right after church. And then there's not hesitancy. You've got your community partnering with you to do that. So again, I don't want to minimize it. I was very pleased that AARP this week had a town hall for Black elders featuring our Surgeon General, Nadine Burke-Harris, and the Dean of Dr. Charles Drew, the Charles Drew Center in UCLA, Dr. Carlisle, and I were able to speak to African-American elders and their questions. And there were some about the science and the emergency approval and 1-shot versus 2-shot, but honestly, it's about how do I get it? How do I get it? And so I think we're making progress, and I want to thank everybody who is not just only getting the shot, but also helping spread accurate information and talk to their loved ones and push back against some misinformation we're seeing out there. Really, word of mouth is making a difference, it seems like, in getting people to come forward and get a shot.
I know amongst my friends, it seems like we went through a 6-week period of trying to find vaccine. Just,
right.
A computer, right. wherever we could find it. Now, Bob in Fairfield has a question for you, Kim. Bob, you're on line 1. Go ahead.
Hello. First, Senator Dodd, I want to thank you for voting to pass SB 48, which helps primary care physicians better identify and treat patients showing signs of dementia. But for Director Wade, I'd like to ask, since the Master Plan for Aging says we need to explore dementia training for physicians, and this bill seems to do that, what do you think of that bill? And is this something that Department of Aging can work to support the bill?
Sure. So thank you so much for the question. Boy, we've been so lucky to partner with Maria Shriver with her passion and expertise on dementia, and frankly, all the families and consumers with dementia who have come forward and shared their experience. Yes, we need to, this is a centerpiece of the Master Plan for Aging. You see the governor's budget is proposing training in all direct care workers, in-home supportive services and other care workers to make sure they can provide dementia-friendly care. You see grants to cities and counties to do dementia-friendly blue zones, grants for research in dementia, grants for public education. So we're very much interested in a coordinated, comprehensive, and I think there's no question that this issue of the need for a diagnosis that the families are lifting up in legislation is something that requires close consideration, and that we've had good conversations with them and with the Department of Healthcare Services about what would it take to really standardize and make it statewide to have that diagnosis, which is that ticket to the right care plan that we know people and families need. So I'm very excited for the leadership in this area. I think California is poised to really take some bold steps on Alzheimer's, and grateful for the partnership on it.
And can I add, from an advocate's perspective, I want to thank you for calling in. And I also want to point out that Justice in Aging, if you go onto their website, has a list of all of the bills that are related to the Master Plan on Aging, that the group of us who were stakeholder advisory committee members, as well as a much broader audience of stakeholders, have supported in this legislative cycle. So again, it's the justiceandaging.org. If you go to their website and you look up legislation related to the Master Plan for Aging, or MPA, it's the acronym, you'll find that there, and thank you.
We have Mark on line 3 with a quick question about 65-year-olds and the criteria for getting a shot. Mark, you're on.
Okay, thank you. First of all, I want to thank KSVY and Senator Dodd for making these town halls possible. It's very, very important and helpful. So I hope someone there can answer my question, because I haven't been able to get it answered yet. A friend of mine insists that the requirement to be 65 to get your COVID vaccine is based on the year of your eligibility and not your birthday. For example, I turned 65 in October, and he insists that I'm now eligible to get it. That's not my understanding. Can anybody clear this up?
Anybody?
Did you say you're 65 later this year?
Yes.
I turned 65 in October.
Okay, I'm in October.
So I'm not technically.
So here's my answer. I'm going to answer you in 2 ways. I'm going to answer you in the letter of the law and in the spirit. I think you're right. You are not 65. So 65 and over, you would technically not be eligible. I think that our public health partners are wanting to get shots in arms and are really trying to vaccinate people, particularly as supply increases. Our pharmacies are certainly doing that. Your healthcare provider is certainly doing that. So I do think it's worth you asking. Again, on Monday, The criteria was opened up in California for people of all ages with high-risk medical conditions or disabilities. So I don't want you to share any information with me here, but if you have any of those conditions and you would both by the matter of a law and spirit be eligible. But I do think our public health folks know that every shot is a good shot at this point. So it's worth checking.
Okay, thank you. I appreciate that very much. Thanks to all of you. Take care.
I have to say that the first time since I was 20 that I wanted to be older. And that's just to get the vaccine. Frank Nelson, is there anything new in regards to Medicare in 2021? And is there anything seniors really need to think about when they're looking at their coverage? I mean, we have the Advantage plan, we have the regular Medicare. Those are two distinctly different things, I guess, in terms of supplements. And has COVID exacerbated anything within the Medicare system in the last year?
Sure. When we look at changes, of course, there are annual changes, which is good for people to review, especially during what's called the annual election period, October 15 through December 7. But specifically, there is a time frame that many people are not aware of, as it came into being it was the year before. It's called the Medicare Advantage Open Enrollment Period. So many of you are familiar that every year you can review components of your Medicare. So if you have it as original Medicare, then you have a separate Part D drug plan. And every year all those change, so you need to review it. For the Medigap supplemental piece, the time to review it is a different time frame. It's your birthday plus 60 days. Now, if you have an Advantage plan, again, that October 15 through December 7 is your chance to review it. But now we come to a new time frame called the Advantage Open Enrollment Period. So here's the rule. If January 1st, you have your Medicare through an Advantage plan, you have an additional period of time until March 31st to make changes, either from the Advantage plan you're in to a different Advantage plan, or from the Advantage plan you're in back to the other way you can have your Medicare through original Medicare. And of course, there are advantages and disadvantages of how you choose to have your Medicare. And those advantages and disadvantages many times are very specific to your health needs and so forth. But it's important for people to know that this open enrollment period from January 1st through March 31st is available to those people who January 1st have their Medicare through an Advantage plan.
I've navigated it, and it also helps to have a really good insurance agent who cares about you.
Well, and there are good insurance agents out there, and they are compensated by the plan that they are contracted with. So, for instance, in Sonoma County, there are 16 Advantage plans to choose from.
Wow. Senator Dodd, a question for you. I don't know about this at all. How does the Golden State stimulus package impact California seniors?
You know, I don't know the answer to that question. I think that's great. I know somebody who does.
I could help with that. We are so thrilled that seniors are included in the Golden State stimulus, thanks to the partnership with the governor and the legislature. A couple different ways. So if you get the EITC, the Earned Income Tax Credit, did you know California is the only state in the country that lets seniors claim the EITC? So if you are a low-wage working person over 65 and filed an Earned Income Tax Credit, you can get the Golden State stimulus. But wait, there's more. If you are on SSI, so you are a low-income older adult or person with disability, you can get the Golden State stimulus. And there's another way. If you are caring for a child who is on the CalWORKs program, a lot of grandmas and grandpas out there, grandmas whose babies are getting CalWORKs or TANF, you can get the Golden State stimulus. So we are so happy that the Golden State stimulus included older adults as grandparents and caregivers, older adults as workers, and older adults as people with low incomes who can benefit and need that money as part of the recovery. So it's really, as we say, it's both about doing special things for older people, but it's also about including aging in every single policy that we roll out in our state. And so it's Golden State Stimulus ended up being a really terrific example of that. And the legislature's partnership is a big reason why.
What is the Golden State Stimulus Package?
Well, we had
Go ahead, Senator. Yes.
Well, the state had a stimulus package for business. Well, look at all through from top to bottom, from people to businesses, nonprofits, the whole 9 yards. So it's one big package of perks, if you will. Kim, why don't you pick it up from there and get into some specifics?
You said it exactly right, but it'll be a one-time, for individuals and families, it'll be a one-time payment of $600 or $1,200 for singles and couples. So it is cash in the pocket to help you pay your rent, to help you feed your family, of course, to help our local businesses stimulate the economy. So we hope, again, that 1-2 combo with what's coming from Washington as well will really prevent some of the worst suffering and get us back on the road to recovery.
Karen Amos asks, and I think this is a federal question, but maybe your opinions would be valid. Why is it that with minimum wages being raised over the years so Americans can make a decent wage and pay their bills, that seniors on Social Security only get a pittance of a raise and are expected to live on that? Any comments?
That's an important question, and it's something that we absolutely are advocating for changing. And it points out what the inequity is, and it also addresses the fact that we have, as a society, not done the planning necessary to account for those extra 3 decades I talked about at the beginning, where we've collected 3 decades of life to live, but we've done very little planning, which is why the master plan is so important in California, and that we hope that it's viral in the way that it gets spread throughout our nation, and that very hopeful with our current administration in DC that we will begin to see some receptivity. We hear you, we agree with you, and we are pushing for this. So I would say get involved and make your voice heard.
We have a question about the taxability of the PPP monies in California. It's not taxed on a federal level, but this Deborah Burnett from Davis asks, as a California resident, senior business owners receiving PPP money, why I and other state-located business owners should my business be subjected to California business income tax on the PPP money when the federal monies are not taxed as income?
Well, that issue has not totally been resolved yet. So we're hoping that the administration and the legislative budget team will be to some sort of agreement on that sometime in the, maybe in the next day or two. So it's certainly not it's not nothing yet. We're working on a bunch of different plans, and people understand what's at stake here for senior business owners.
It's all complicated, isn't it? It's so complicated. The stimulus and the people with pre-existing conditions who want to get the vaccine. Everybody wants to get the vaccine. But Diane Garcia from Petaluma asked about the underreporting to the vaccine adverse event reporting system. It's been highlighted over 30 years. It's still an ongoing problem, making reliable statistics regarding vaccine adverse reactions hard to come by. CDC has now created a new smartphone-based tool to use to track the adverse events following COVID-19 vaccine called VSafe. However, only if the CDC deems an adverse event reported to VSafe worthy will it be added to the VAERS database. Unacceptable, and public should demand that adverse events all be reported through VSafe. Absolutely necessary for complete and consistent data as well for transparency. I guess that's more of a statement than a question. But do you have any comments on that?
No.
Yeah, and I would just say we've been committed to transparency. We've been committed to science and going where the data leads. The governor has a Western States Scientific Advisory Committee with the best minds in the West Coast reviewing the CDC. And anytime one of these issues comes up, it's looked at, and it has not been a significant of scale issue. The best advice from all the scientists is get the shot and trust the science.
Well, there have been a number of people that I know, not myself, have got adverse reaction for maybe 10 hours, 5 hours, 4 hours of the second shot. And everybody was worried about it, but it wasn't that significant. And my wife and I had no reaction. It seems that vaccines are the way for seniors to get back in touch with their family and get back in touch with their grandkids and get back in touch with their friends and have dinner parties and still be responsible. There just doesn't seem to be a downside to the vaccine. And I'm not an expert, but that's just my commentary because I'm the host. Senator Dodd, that about brings us to wrap-up time. I'd like to have your closing comments, if we may.
Well, Rick, once again, I want to thank you for hosting this, 8th town hall, and I'd also like to thank Debbie Toth and Kim Mccoy Wade and Frank, our awesome man for HICAP. Thank you for taking time out of your busy personal schedules to be here at this event. We appreciate it very, very much. And also thanks again to KSVY.
Well, it's been our pleasure. It's been our pleasure, Senator. And that does it for this edition of the Town Hall with Bill Dodd on senior issues, very near and dear to my heart. And we'll see you again next month, probably, huh? You bet.
Thank you.